Mute my own name.
Jamie?
Yes. Hi, can you hear me?
I can.
Awesome.
And I'm also excited. I see that we have 11 people attending.
Fantastic. Welcome everybody to the Opioid Settlement Advisory Committee for Penobscot County's review of the application for funding for this first round of RFP. We really appreciate everybody showing up and showing interest, and hopefully we'll be able to go through this application today and answer some questions and make sure everybody is well prepared and knows exactly what to expect for this first round of settlement funding. So just to kind of briefly introduce, my name is Jamie Beck, and I am the chair of the committee for right now. We have one of our other committee members, Pat Kimball, is joining us virtually. If you want to say hi.
Hi, my name is Pat Kimball, and I'm a member of the Penobscot County Opiate Settlement Committee, and I'm excited for all of you to see the grant process that we have laid out. Under Jamie's leadership as chair, I think we have cross your fingers. I think we have a simple application that's not complicated, because that was our goal. And that we've given all of you, as you'll review it, enough time to be able to participate and share some of the things that you'd like to see this opiate dollars go to. So welcome, everyone.
We do have other committee members who are not present with us today. We have Angela Walker, Randy Jackson, Sheriff Troy Morton, and Wendy Data, who is the Penobscot County Commissioner's grant writer for the county operations. So those are all the other committee members who sit with us here. Just to kind of go over what this is about, this opioid settlement money was awarded to the county as part of a settlement from lots of different pharmaceutical companies. People are probably well versed in that, but the county itself currently has received about $1.4 million out of the projected $4.5 million that the county is expected to receive between now and the end of 18-year period, which I believe is 2038. So we've got some money that has already come into the county. The commissioners have already allocated a bit of that money, but we're charged with being able to put out this RFP for $400,000 worth of additional awards for this first round. And it has to fall in line with the guidelines that are appropriate uses for the settlement funding, and we'll go over that in a little bit. But that's the core purpose of this grant. As far as just some housekeeping logistics, we're gonna try, because I do have a fabulous tech person in the room with me, but because I am as far as committee members go, sitting by myself in this room, and logistic wise, if you could put any questions that you have in the chat, I'm happy to include that in this webinar, which is also being recorded and will stay on the County Commissioner's YouTube to share out whenever you would like to. It's live right now on YouTube. And Pat is also able to jump into the chat and answer questions that way too. When we're done with today's meeting, the link for this webinar is going to be posted on the same page as all the other Penobscot County opioid settlement funds on that webpage. And we'll be working on turning the questions and answers from this conversation today into an FAQ document to also live on that webpage, in order to make this process as equitable and open and fair as possible. As questions come in over the course of this application period, we will continue to post new questions and answers in that FAQ on our webpage. So if you check back regularly, anybody that's emailing in questions to Wendy Dana, who's going to be fielding those questions, or wants to have assistance, any ways that we are helping will be open to everyone who is applying. no matter what size organization you are, everyone is going to have the same access to the same information. Okay, so that being said, I want to shift into kind of where we're headed with this. The 6 of us who sit on the committee, the structure of this is that the 6 of us who sit on the committee are going to look at, after all of the applications come in, the number of applications that we'll be able to score given our own conflicts of interest. We're going to try and make sure that we have at least 3 scorers per application, so it's kind of spread evenly and we have an average score. But once we get a sense of the scores that come up to the top, we then give our recommendation to the county commissioners, and the county commissioners make the final decision on what applications will receive actual. So our committee's role is to create this application, review applications that are submitted, make our recommendations, and then that will go to the county commissioners for their final approval, and they can share out the award afterwards. We want to make sure that all of the applications coming in are, like I said, following that Exhibit E guidelines, and that is going to be part of this application process. I'll show you in just a minute, and that's accessible on, like, if you Google it, you'll find it. I'm going to shift over and share my screen to. So the application that is online is a Google form. I'm going to share my screen for the actual just document. It has all the same fields on it. It just is easier to click through because that Google form, you have qualifying required entries, and I don't want to have to make up something and put test in through all of those. So, all right. So everybody should be able to see that. Pat, give me a thumbs up if you can see that. Perfect. Okay. All right. So again, the executive summary is on there. Going through the actual qualifications for this, the application opened on October 1st. It will close on November 15th. We, like I said, have about $400,000 worth of funds to recommend for award. We're doing it in tiered amounts so that you kind of have an idea of what allotments of funding we're looking at sharing out. The first tier is up to $10,000. Second tier is $10,000 to $25,000. And then the third tier is up to $49,999. This is a 1-year award. So when you're thinking about what you're wanting to apply for, just make sure that those activities are going to happen within a year from your award. Eligible applicants. We decided to allow both public and private entities, nonprofit and for-profit, because we know how much work is done in the field on both ends of that spectrum. There will be a preference for nonprofit organizations because funding for those organizations is more likely to be reliant upon grants versus revenue based from a business. So I'm not going to read through this entire description, but it gives a little bit of a background about that opioid settlement fund. Applicant qualifications. So getting into what we're going to be looking at for the needs for this settlement funding. We want to make sure that any organizations applying, they have to be serving people in Penobscot County. They can serve people outside of that geographic area, but all of the grant planned activities can only target Penobscot County. Statewide Statewide Recovery Council, Maine Recovery Council, MRC, has their own pot of funds that deals with a broader portion of the state, and other counties and other municipalities have received their own funds. For the purposes of this application, we're just looking at supporting organizations and helping people in Penobscot County. The status of the organization, I went over that a little bit, whether it's faith-based, community-based, or if it's private, public, nonprofit, for-profit, please apply. We are going to, like I said, give preference to nonprofit organizations who do rely on a more stringent revenue source. And this is kind of how this RFP goes. Again, the total amount is up to $400,000 for this first round. I know that I'd had a question before asked of when the second round is happening. Guys, we haven't even done this one yet. I'm just kidding. We're not sure. We want to make sure that we get through this grant process and we have a really comfortable way that we're going to move through future processes by learning from this one, and it will be up to the commissioners when that next grant process starts. So to be determined. This is again reiterating some of the things from the top in just more detailed sentences rather than in the table. Organizations can't submit more than one application per application acceptance period. So this I wanted to highlight because people might ask, do you have a opportunity to appeal a decision if you were if your application was declined? Not for the purpose of this funding, because we are going to be opening it up for subsequent rounds of funding. So for each round of funding, you can reapply, but for each application acceptance period, you can only submit one grant or one application per that acceptance period. Future ones, you can ask for or submit another application. Proposals must focus on communities and individuals most profoundly impacted by opioid use disorder and/or co-occurring substance use disorders or mental health conditions. This is just inherent of the grant funding and the source of funding coming in. So please be sure that when you're speaking to in your narratives what the funding will be used for, that it aligns with that. As far as awardee requirements, make sure that you're utilizing the funds within 1 year award receipt. And that this is really crucial. You can't ask for money and we cannot award money for projects or programs that are already ongoing to supplant the funding that is already being acquired for that activity. So let me say that again in a slightly different way. If this money will replace funding that is already happening for a program that's already happening, that's not an appropriate use of the funding. This can be used for expanding the program, but it can only fund that expansion of the program. It can't replace the funding for an already existing program. Just so everybody is clear. Obviously, we're going to look at making sure that the funds are used in alignment with that Exhibit E. It is highlighted blue here to the link. This is the nationalopioidsettlement.com. This is a PDF, and that is linked in the application as well. So you can take a look at it there. And I believe it's also on the webpage that for our opioid settlement advisory committee through the commissioner's website. As far as requirements for performance monitoring, in an ongoing way, awardees are going to need to provide data on program outputs, outcomes or impacts following the metrics that we'll get into in just a minute. And then there will be semi-annual reporting. So a 6-month report and a year-end report, including all of these pieces. And you will have lots of guidance around that should you be awarded funding. As far as our scheduled timeline, again, we posted on October 1st and opened it. The applications are due November 15th. We anticipate trying to get the committee will do the review and recommendations to the county commissioners by mid-December. So the commissioners can look at what we have recommended and make their selection announcement by the end of this calendar year. So the anticipated performance period will be 1 year from award receipt. You'll again go through probably the same way you found this link through the Penobscot County Opioid Committee webpage. The applications on there, all of the applications need to be submitted through there. so that it's easy for us to go through and score these things. Just as an aside, this committee is volunteer. We're not paid. We do this because we care, not because we're receiving any funding to do so. So we're trying our best to do this efficiently and effectively and ensure that everybody's getting their awards out as quickly as possible. But please keep in mind, we are volunteers and we do have other things outside of this moment in time in this activity. So scoring process. I'm going to read through a little bit of this just so that it is clear and it is stated out loud. The Penobscot County Opioid Settlement Fund Committee aims to distribute funds equitably across the county to ensure all communities have access to vital resources. The goal is to select a diverse portfolio of projects that collectively address the opioid crisis from multiple angles. Applications will be reviewed and scored by our committee using a standard set of rubric criteria and recommended to Penobscot County Commissioners for final award approval based on the merit of the entire application. The committee strives to recommend quality projects for funding. Therefore, all applications must achieve a minimum score of 30 out of 50 possible points to be considered for funding. While the scoring rubric is the primary method for evaluating an application's merit, the committee will consider additional factors when making final funding recommendations. To achieve equitable funding across the county, the committee will give primary consideration to applications with the highest scores in each pillar. By pillar, I'm going to pause here and let you know. So there are 4 pillars that are contained within the remediation of opioid use disorder. There is treatment, there is prevention, there is recovery, and there is harm reduction. So we're looking at making sure that we're recommending equitably across the county projects that would address each one of those pillars as best we can, given the projects that we'll be getting in. That means that if 2 applications have similar scores, the committee may prioritize the one that serves the geographic area that has not received funding yet to ensure a balance of geographic representation and or provides resources to an underrepresented pillar of the 4 pillars. So we have 10 different scoring criteria in our rubric. Each of them receives 10 points. No, I'm sorry, 5 points. 10 pieces, 5 points each. That would be a maximum total of 50 points that you could receive on our scoring criteria. That's why we kind of set the bar at anything below 30 points is not going to be a project of quality that we want to move forward with. I'm not going to read through all these things because I am confident that you all have this information in front of you and you can read through it. If there are questions about what any of them means, I'm going to just briefly touch on them. Adherence to application, please make sure it is clear what it is that you're doing and all the things have been fully filled out. Organization of information description. We're going to get into that in just a minute, looking at kind of the narrative sections of the application and the project description as well. Priority population and geographic area, that's going to help us make those decisions about whether or not we've covered the entire county in spaces that need to receive funding for different projects. Data to support the need, the timeline, making sure that that's a feasible timeline that you're presenting to us for the project you're asking funding for. The scope of work, making sure that you have data tracking down and are able to present SMARTY goals, which are specific, measurable, achievable, relevant, time-bound, inclusive, and equitable, so that when you're reporting back for your 6-month or 1-year reporting, that's easily shared with us and then we can share with the state. And ultimately, it's just to make sure that we can demonstrate what the impact is of these opioid settlement funds. Also want to make sure there's a sustainability plan and that the budget is clear, as well as the narrative. I'm going to skip past this piece because that is all part of Exhibit E, but these are just examples of approved uses in each of the pillars. skip past definitions because that's all in there too. So again, this is kind of like the fields that you'll have to fill out for the grant application. One thing that we wanted to make sure that we understood about our applicants is whether or not you have someone with lived opioid use disorder experience in a position of leadership, knowing that we, as a committee, and I think in the harm reduction and recovery treatment kind of sphere, really value people with lived experience. So that's important to our committee to know as well. Making sure that you, as we move through this in your project information, filling out lead people who are going to be kind of reporting back and who to contact with questions. You do not need to be a standalone 501c3. You can have a fiscal sponsor. That's perfectly fine. Make sure in your organization description that we have a really clear picture of what it is that you are doing as far as an overarching organizational purpose in your programs. And then in the project description, so the narrative for your project description, the things that we really want to know about are how the proposal will address the outcomes associated with opioid crisis, because that's specifically speaking to what this grant is geared towards. Obviously, your goals and expected outcomes for your project, how your organization group has or will have the capacity to successfully implement the project. These are all kind of basic and crucial pieces for us to be able to know what's going on with the project you're proposing funding for. Make sure that you're picking which pillar. We ask that you can only pick one because of the way that we're trying to spread money across the county. We want to make sure that that's equitable. So if we have too many applications that are asking for funding in the prevention arena in Lincoln, just throwing it out there, I don't know. We want to make sure that we've kind of thought through, okay, well, we've addressed prevention here, where else can we address it? So that's why we're asking you to pick one for what your project is addressing. If it's a new or existing project, if you have an existing project, how many individuals are served annually? If it's a new one, is the project evidence-based or considered a promising practice? I want to caveat, we are not going to count as a detriment if your number for unique individuals served annually is small compared to others. This is kind of where the whole pillar thing comes into play, because if we're talking about the availability and disbursement of naloxone versus how many beds you have in a recovery house, those are two very different things that we're thinking about in the impact and the number of people served. So if you're looking at that going, we don't serve that many people because of what our program is, we are going to match that idea to the actual program or project that you're doing versus we're just looking at projects that serve at least 100 people. That would make no sense. So that's kind of our thought process as we're going through and scoring these. We're going to kind of fit that to what that exact program or project would need. Priority populations, there's going to be some drop downs there in the geographic areas served where you can pick multiple different demographics that your project will serve. As far as the rationale and data to support the need for the project, we love seeing the local data and rationale. If you can align it with an Exhibit E allowable use, that's going to help us understand what it is that will have the impact on. So I'm going to repeatedly say throughout this, if you can show that it's aligned with Exhibit E and the allowable uses, if you can demonstrate obviously the need and then what is the impact of the funding that you would receive. Just a high level project timeline, if it's over a period of time, or if it's a one instance thing, we want to know kind of what that looks like. If you have any partners or expected roles, please do include your MOUs with that so that we understand that relationship. And then there's going to be a space to list your SMARTY objectives. Thinking about how you're going to collect and track data so that we have an idea when we are able to recommend for award, and the commissioners award the funding. We can go back to this and say, okay, this is how this is all going to align. As far as the budget goes, obviously, please tell us the amount that you're requesting. And then in the budget narrative and spending plan, there is a separate document that is attached that you can download and then re-upload in your the document attachments at the end of the application. That is a template budget with a narrative. So let us know kind of what you're thinking of where the funding is going, what you're going to be spending it on. If there are any other sources of funding that you are using as matching funds, or you already have some funds coming in for it, that gives us a better sense of if what we might be able to award to is gonna meet the needs and the goals that you're laying out.
Jamie, can I just make one comment here about the budget?
Yes, please.
For people who are listening in when you do your budget, I know that often in nonprofits, sometimes your budget can be a negative, that it's and so if it is, what you need to, in the explanation, put why it's in the negative and how will you do that to make it so that it's not. And also, if for some reason there's a surplus in that budget, please explain why there's a surplus in that budget. That way, who's ever scoring that grant has a concept of the fiscal responsibility of the agency that's applying.
And I want to add on, thank you, Pat. I want to add on to that too. When we looked at the part where it was whether it's an existing or a new project, we want to encourage people who do have new ideas to come forward and ask for funding through this application process, and not expect that, just well-established organizations and entities are they're gonna automatically get it. We want to consider everybody, and knowing that the opioid crisis is widespread, and there are lots of people with really good ideas that haven't been tried at a macro level yet. We really want to encourage people at any level, whether you have a small organization, you are a group of college students wanting to do some work with your peers, or you are a large hospital or clinical setting organization. We want everybody to apply so that we can really kind of tease out where the best places to put this money will be. So that kind of wraps up the end of the actual fill-in part of the applications. I do want to say about the attachments that you're going to be asked to add, making sure that your governing board list is attached, as well as the project lead or key staff that are going to be working with the programming or project that you're requiring or requesting funding for. Again, that budget template, which you can download and fill out and then upload again. And then letters of commitment from any partners that you have or your fiscal sponsor. No more than 3 letters of support. Please make sure those get submitted through through your application form, and not just emailed or mailed in, so that we know exactly what's going on and we're not getting multiple letters of support outside of that one application turn in. Make sure that you've got your letter of nonprofit status if you are a nonprofit, and your EIN, and supplemental materials if you would like. Let me look back at my agenda to make sure that I covered everything that we're going to talk about here. Pat, did you have anything else while I'm looking?
No, I think you covered it pretty well. Again, we're also interested, again, and I think Jamie mentioned it, if you receive other opiate settlement dollars, so that that we know that, so we make sure that we don't duplicate funding. Again, you may need more funding for a project, that's different, but we just want to make sure that we're not duplicating the funding. So if you're applying to one, please let us know that, so we can look at that when we're doing budgeting. And I think Jamie pretty much went over it. I mean, again, we are looking for evidence-based promising practices, but that's pretty wide open. Again, we don't want to encourage, we want to encourage both small and large organizations to be able to apply for the grant. And I think we never know until people start getting in and start writing it. We think we've made an application that's fairly reasonable for people to be able to do. And again, we're pretty open to questions. For those of you who are familiar with federal grants, we're not abiding by federal laws. If you have a question or you, for some reason, can't get into the site and you need help with that, I hope you reach out to us to be able uh, uh, to help you make sure that that's not our computer glitch that stops you from getting that application into us. But Jamie, I think, did a good overview of the grant.
Thanks, Pat. I just did want to throw out too, you cued my memory as far as receiving other opioid settlement funds. If you previously received opioid settlement funds either from the county, the city of Bangor, or Maine Recovery Council, that's okay. You're still in the running, or your application will still be reviewed in the same way as anyone else's. Like Pat said, we just want to make sure that we're not reduplicating efforts and that the application that you're submitting to us is either an expansion or a new or different project to be using the funding for. And the other thing too is, nope, I had it and then I lost it because I see that we've got two questions. Someone in the chat asked if there are any guidelines about which tier is the best fit. That's something that your organization's gonna have to figure out as far as what the funding needs are for the program or project that you're going to be submitting a funding request for. Hopefully that helps answer that question. Again, any number, like submit into whatever tier you would like, and we'll take it from there. And then it looks like we have a hand raised. Yes, that's fine.
Can you hear me?
Yes, hi Scott.
Hey, good afternoon. I have a question, and I've got it about done, but my question is on the budget sheet, the grant application budget sheet under expenses. Say you have an expense, and then the furthest column over says, what program objective does this expense meet? What does that mean?
So if you have an expense that is like you need food for a program. So that would be an expense. Let me pull mine up on my side just so that I see exactly what it is.
It's under, the question would be under wages and salaries, the amount, description, and what program objective does this expense meet? And that's where I have no idea what you want me to put in there.
Okay.
And it's under, I can't pull mine up, but it's under salaries,
Yes,
expenses.
it's the expenses, and then it says budget line, which
Yeah.
there's several things listed, the amount.
So some of them may be not applicable, and that's okay. You don't have to have something filled in for every single line. I see where you're looking here, Scott. Let me see if I can share my screen.
Yeah, I see it, but that I can't figure out what you want.
So this is what you're looking at, right, Scott?
No, it doesn't look, yes, that's what I'm looking at. Yes,
Yeah.
it's just a little bit
Okay.
different. Okay, yes, under expense, yes, your form is different than what comes up. What comes up. But I could share my screen with you, I would, because it does look different. But under expenses, it lists the budget line item, like there, the
Yep.
amount, the description, it calls it a description, the type of expenses there because it's listed down below.
Yep.
And what program objective does this expense meet? What program objective does this expense meet?
So this would align with when you're making your SMART goals.
Yes,
If
which I
your
do.
goal is to expand, like if your goal is to buy another recovery house
Okay,
and the expense for a consultant, which might be a realtor, that would, the goal that you're trying to meet is buying a new recovery house. So the consultant's fee goes toward that goal.
all right, but
Does
it's
that-
under wages and salary, and it's a small amount.
Yeah, so
And
you
I-
probably wouldn't, that may not necessarily match a SMART goal.
Correct, that may not.
So
Correct.
if it doesn't, then you would leave that part of
Leave
the,
it blank. Okay,
would leave
Yeah.
it blank.
it's pretty
Yeah,
easy to
it's-
But
figure
if
out.
part of your SMART goal was to increase staffing,
Yeah,
then
yes,
you would put that in there.
okay, I understand that. Yep, it is not, that's not part of our,
Okay.
yep, that's not what it is.
That's a
It's
good
small
question
amount.
though.
Yeah, it was a stumbling block for me. So anyway, good. That was,
So-
believe it or not, that was my only question. Thank you.
It's good that you want to fill in all the blanks.
Great. Thanks, Scott. Yeah, and if anybody else has any other questions about, well, I don't know, like this doesn't make sense for whatever goal it is that we're trying to achieve with the funding. Leave it blank, and if there's something that you want to say about it, put it in the actual description. In that budget narrative of this didn't seem to apply, but I'm gonna give you some sort of explanation in that narrative. Okay. Will a recording be posted on the opioid website? Yes, so this is already live on YouTube right now, so if you went to the county commissioner's YouTube page, you'd be able to see this in perpetuity. But we can put the link on the actual opioid committee web page for people to go back and watch. So I don't know if anybody else has any other questions that they'd like to ask at this moment. Like I said, we go ahead and email Wendy Dana. Her email address is on the actual application and on our webpage to be able to contact her and ask questions, and we'll be creating an actual like written FAQ to make sure that all the questions that were answered today, as well as any that come in later, are available for anyone to see what the question was and then our response. Do we have-
Just quickly, Wendy is currently on vacation.
Yeah, she'll be back
So-
next week.
Yeah, so she'll be back next week. So if you do it this week or whatever, there may be a delay in getting that question answered till she comes back. And then I see Heather Blackwell here. Did you see my question
Do we have a Q&A area?
from PCHC? Did you see my question in the,
Oh, I see. Just kidding.
Yeah, another screen. that-
Oh.
Thing.
One of these spots, Zoom needs to consolidate these, I guess. Julie, I hope that you were able to hear us. I noticed that you said as the audio started. And then Heather says that they would like to apply for more than 50,000, but could still use funds below that amount. Should we apply for both this round and round two, or should we wait until round two? Worded another way, if we receive round one funds, does that make us less likely to receive round two funds? The answer to that, to the best of my knowledge, unless the commissioners decide something different, is please apply. Please apply now for what it is that you can use now. We want to start getting the money out. And if you apply for the first round, that does not mean that you have less of a chance. The second round particularly, I'm thinking personally, and this is me thinking this, not the committee, not the commissioners, but if this is a project that is like a two-phase project, or it is a continuation of something that you started, but you have a sustainability plan beyond the time that the funding is available, that is going to be just like, that's likely to rank higher on the funding list. So hopefully that answers, Heather, what you had asked in that first question that you sent over. But yes, please apply now for what funding you do need. And we'll take the next round as it goes. You had also asked, Heather, can't supplant funds, but can we ask for funds to go toward an existing program that is currently underfunded or has gaps in funding? Pat, I'm going to let you take this one because you are well versed in how that happens.
So if you're currently underfunded, so if your project is trying to expand, or if you have more clients than you expected to have originally with some funding, then that's not supplanting, that's expanding your programs. I hope that is helpful. What you can't do is take this money, put it in a project, and then take money that was allocated for that other project and go someplace else. We don't supplant. So if you have a project A and that is funded by this currently by the state, then you can't take this money to add to that unless you are expanding the program. Then it's not supplanting, it's expansion.
I think her question might also be around if you have a project that doesn't have full funding but is part of your budget and you have a budget deficit, is it an allowable use to ask for opioid settlement money for funding that project?
In my mind, it is. Again, we're not the final say. Well, again, you look at it, but if your project is underfunded, if you can't sustain your project on the funds that are given to you, then this would be an appropriate use of funds. I'll use the example statewide. The low barrier shelters were funded by some of the opiate settlement funding because their funding was insufficient to maintain low barrier shelters within the state. And so money was used in those cases to be able to keep providing the services because the funding they currently received was inadequate.
Yeah. And I think it also a little bit depends on what it is for the activity that you're doing and what part of it is underfunded and how well it aligns with the Exhibit E allowable uses. So just keeping those pieces in mind as you move forward with your application and try and make it as clear as possible what it is that you're asking the funding for and why there's a funding gap. We've been back and forth between the Q&A and the questions in the chat. Lizette asked if you have,
Sorry.
that's okay. If you have a large organization, can you submit 2 projects if they're in different districts? I'm curious what you mean by different districts, Lizette, because we're dealing with all of Penobscot County. I know we talked about like areas of the county, making sure that the funding is spread across the county and not just concentrated in this area, in the Bangor area. Is that what you were kind of thinking about? 3 districts in Penobscot County. Okay, so for each of the commissioners. Gotcha. So the way that we set this one up is that each organization can only submit 1 application per application period. So yes, even if you are doing if you're servicing multiple areas in the county, that you would only submit 1 application. So Lizette, in this case, if you're looking at Bangor, but also Millinocket, consider who else might be applying for money under that pillar in Bangor versus Millinocket. I can't believe I just said Bangor. And where we would more likely put funding if there were not enough projects to cover that pillar in any area of the county.
And so the main thing to remember is no organization is going to receive more than $50,000 or $4,999.9. So if you want to serve more than one area, you can submit that to say we are going to serve both Millinocket and Bangor. But if it's under one organization, then each organization will only receive the max. They can't have, just because they have a satellite program in Millinocket and one in Bangor, they can't apply for two $50,000 grants and get $100,000. The organization will only get $50,000.
Okay. I think we had a couple more questions. Marge says award notification is December 31st, but when is award receipt? As soon thereafter as possible. The county was pretty quick to get money out to anyone who applied during the ARPA funding grant cycles that they had put out. And during our next meeting, when Wendy Dana will be back, she could probably give a better response to that, but I think it's fairly quick. So yeah, beginning of 2026 would be it.
Yes.
Knowing that we're moving into, like, the commissioners were hoping to be able to give this to them in enough amount of time, mid-December, that they will be able to make their decisions about who will be awarded funding by the end of 2025. So early 2026 would be when funding would be able to be awarded out, like received by.
And if anyone's on here that received funding from the Maine Recovery Council, in full disclosure, I'm the chair. This funding will not get tied up in the red tape that the Maine Recovery Council funds get. That's just state government and the way that those fundings are and those contracts are. Penobscot County doesn't have that. And so that we have been assured, once the commissioners approve the projects, that you will receive the funding in a timely manner. And that will be, I'm assuming, like ARPA funds were given away. Their hope is not. And again, for anyone who's on here that received grants, I apologize. And I know there was some delays in some of the contracts beyond our control, but you won't see that with this round of funding.
Right. It's already in the county's bank accounts. So
yeah,
being able to send that out there is very little red tape that needs to happen. It's just the commissioners need to do their bit, and then their administrations will take care of the rest of it. And Wendy Dana is fantastic and knows grants inside and out, and she'll be the one to whom we will be reporting should you get an award. She is very eager and willing to help anybody with any questions you have around the grant application or assistance in figuring out what it is that you need to put into any space beyond what we've shared here. And then should you get an award, she's really phenomenal at helping to get the data back into the county and the ways that we need to receive that money back. Or not money, the data back. Any other questions while we're here? We've got about 10 minutes, but I'm happy to let you guys go early if that is it for now. Again, this recording will be posted on the Opioid Committee webpage, the link to it, and then we'll be developing a Q&A document so that people can view it afterwards. Great. Well, I don't see any other questions coming in. Thank you all for joining us for this webinar. We appreciate it. Good luck with your submissions and writing of your grants, and we look forward to connecting with you and hopefully saying everybody gets money. We're going to be like Oprah. Have a good day.
All right, thank you. Thanks, Jamie, for all the work.